Hello, I'm Dr. Brian Gibson, and I want to talk to you today about peripheral vascular disease. I've done other videos on this, but I figure I'll bring it back up because it's becoming more and more of a problem. There are individuals that we are seeing on a regular basis that have a poor blood flow to their extremities, poor blood flow to their feet, poor blood flow to their hands, peripheral vascular disease. Peripheral vascular disease can be caused by multiple things. It could be narrowing of the blood vessels. It can be plaques or clots inside the blood vessels that are causing that narrowing. It could be thickening of the wall or damage to the blood vessels themselves, or it can even be spasms. Sometimes you'll get certain types of spasms, and the spasms cause those blood vessels to close, and you don't get the blood flow or the circulation that you need. All of these are types of peripheral vascular disease. Now, how is it going to present? It can present as pain. It can present as cramping. It could present as thin skin or white skin. It could be present as blue or dark discoloration of the skin. All of these can be indications that you do have a peripheral vascular disease, or it may be something as simple as if you walk a certain distance, you start to get pain and you have to stop. And once you stop and get back up, then you can actually work again because you're just having an interference in that blood flow. So if that's the case, if you're saying, okay, I have a peripheral vascular disease, then you need to understand that there are things that can be done for this. You should be evaluated, and we should determine how much vascular disease you have. Because sometimes it can be something simple. You can change the way you're eating. You can change the amounts of exercise you're doing. So those kind of things can actually modify it. Sometimes it's more severe disease, and you need to get help medically or even sometimes surgically. But the point is, if you have a poor blood flow, the big problems come because of that. If you were to get a sore or you were to get an infection, sometimes with this poor blood flow, it becomes a much bigger problem because although you have sufficient blood flow to keep it healed, once it's injured, you don't have enough blood flow to heal it, and you can end up losing toes, foot, even the leg if you're not careful. So if you have a vascular problem, you're saying, okay, I don't have good blood flow, it is worth getting evaluated and determine if you need additional help. This is Dr. Brian Gibson, and this is your Podiatry Tips Day 389, Peripheral Vascular Disease. And you need to understand there are things that you can do to improve your blood flow. And I recommend that you look into it and possibly even get some additional help. If you would like additional information from us, you can reach out to us at utahfootdoc.com, or you can actually come to our office. Thank you. Have a great rest of your day.